Friends, today we will learn about how to correct low sodium in simple ways. Are you tired of complicated formula for sodium correction? If so, let's try this simple method. First, learn few principles. If patient has severe symptomatic hyponatremia, either acute or chronic, then aim to increase sodium by 6 milliequivalents per liter over 6 hours. If chronic with mild or no symptoms or unknown onset, then aim to increase sodium by the same 6 milliequivalents per liter, but now over 24 hours. Now note that total amount of sodium present in one 500 milliliter bottle of normal saline is 77 milliequivalents, and total amount of sodium present in 100 milliliter bottle of 3% saline is 51 milliequivalents. Now there are two simple steps to find out how to increase sodium level. Step 1. Calculate total milliequivalents of sodium correction required, which is approximately 6 milliequivalents per liter, multiplied by weight of the patient in kilogram, and further multiplied by 0.5, or simply stating this is equivalent to weight of patient in kilogram, multiplied by 3. Step 2. Give the calculated milliequivalents of sodium over 6 hours in severe symptomatic cases as described previously, or give the same amount of sodium over 24 hours in chronic, mild, or no symptoms or unknown duration. Now let us see some examples. Example 1. A 50-kilogram man has sodium of 120 milliequivalents per liter with no symptom, and duration of low sodium is not known. Sodium milliequivalents correction required is 3 multiplied by 50, which equals to 150 milliequivalents of sodium, as this is case of unknown duration and no symptoms, so this should be given over 24 hours. If you want to give normal saline, you need to give 2 bottles, or if you want to give 3% saline, you will need 3 bottles to have about 150 milliequivalents of sodium. So you have to give either 1 liter of normal saline or 300 milliliters of 3% saline over 24 hours period. Now next example, a 50-kilogram man with serum sodium of 120 and has seizure. So this is the case of severe symptomatic hyponatremia. The amount of sodium required for the patient is the same as before, that is 150 milliequivalents, but now over 6 hours. This corresponds to 2 bottles of normal saline, which is 1 liter, or 3 bottles of 3% saline, which is 300 milliliters, and should be given over 6 hours. But giving 1 liters over 6 hours would be very high volume, so normal saline is not preferred. Give 300 milliliters of 3% saline over 6 hours, and also look for symptom control, and check for serum sodium level in between to prevent rise of sodium by more than 6 milliequivalents per liter. In summary, this is simple. Multiply weight in kilogram by 3 and give that amount of sodium over 6 hours in severe symptomatic and over 24 hours in chronic or unknown onset with no or only mild symptoms. Please note that this calculation is initial estimation only. You need to adjust the rates of intravenous fluids based on real-time response of serum sodium in individual patient. Thank you.